Dr. Suneel Dhand, thank you so much for being here. Welcome to the Reimagining Healthcare podcast.
Diana, it's a pleasure to join you.
Wonderful, wonderful. I'm so excited to jump into this conversation. But before we get started, how would you introduce yourself to the audience?
For anyone who doesn't know me, I am a medical doctor, internal medicine doctor. I didn't grow up in the United States, as you might guess. I grew up on the other side of the pond. I was born in London, grew up there, went to medical school in the UK. Then I came over, did my internal medicine residency in Baltimore, Maryland. Since then, I've worked up and down the East Coast. I'm now in the Northeast, and I practice mainly clinically hospital medicine. But outside of that, I do a lot of work in the wellness, preventive medicine, metabolic health arena, which is the main focus of the work that I do. I became more active during the pandemic, seeing a lot of the insanity that was going on. And that's where I am right now. My main focus is improving the health and well-being of people and speaking out against all of the other agendas and conflicts of interest, which have sadly intruded upon what's supposed to be a noble profession.
Yes. Wow. Everything you just said resonates so deeply with me as a nurse, bedside nurse for almost a decade in the pediatric intensive care unit. So I get it. And the last 4 years have been very eye-opening, I think, for a lot of us. So I'm really excited to hear your perspective and your experience in this way. And so your channel, it's interesting. So I found you over the last few years, going down a lot of rabbit holes on
A lot
the
of us did, yeah.
right. And as I was kind of looking back at your shows prior before COVID, you were really focused on communication and stoicism and sharing a lot of empowerment tools, it looks like for, not just the community, but also healthcare providers. How did that journey begin for you?
Yeah, so my journey really began after I became an attending physician. I saw very quickly that a lot of what we were seeing were illnesses which were completely preventable. I started writing, blogging about that. I wrote a couple of books on this issue focused on wellness and trying to empower people to make better decisions around all of the decisions every day and fight against the forces around them that were trying to make them or rather make them very unwell. And I also started writing about all of the systemic issues within our healthcare system, which in a very interesting way, I feel are universal a lot of around a lot of different issues in different countries which have very different healthcare systems. I grew up in the UK, which has a completely different system from the US, yet many of the problems are very similar. So I started talking a lot about these issues, and much of what I was focusing on was, as you've already alluded to, how we can communicate better with patients who often are left completely clueless by their healthcare interactions. And then when COVID hit, it was really an eye opener, as it was for a lot of us, as to some real systemic flaws, not only in our system, but also within the medical profession and these huge blind spots that we've had for a very long time really became very evident. And at the end of the day, why I feel so strongly about this, Diana, is that ultimately people like ourselves, we're clinicians, we can make decisions based on our own knowledge. But I really feel for the general public who trust doctors and they trust that they're being given the best advice and that doctors are advising the best policies. But we are far from that. We saw that during the pandemic. And now I'm so glad, even in the political arena, there's more of a discussion around the systemic factors that are really making us ill, including our food supply, which I'm sure we'll talk about, but also the way the system is set up with these enormous conflicts of interest, and sadly, how the people at the top do not have the health and well-being of the country at heart. I'm going to be very blunt here. We are led by completely the wrong people, and we need a complete revolution. We need to absolutely toss them out of their positions, and we need to get people in who really care about the health and well-being of the population. That is the only way we are going to get healthier.
Yes, absolutely. I think too that, what one of the things I love that you speak about so transparently, and also very empowering, and the way that you share this in your channel is about this metabolic crisis and this obesity crisis that we're in, and really getting to the root of that, which, is our food, is our environment, is really these things that most doctors that are in these positions of power, from what I know, especially at the policy level, are saying the complete opposite. I just saw a post of this woman who, her name is Dr. Fatima Stanford or
Oh
something.
my goodness.
I
Yeah.
know. Right. And these interviews that she's doing with Oprah and all these people talking about how obesity is purely genetic. And it's
Yeah.
like, it is really about us unlearning, and like, really breaking apart everything we've learned in medical school education, nursing education, about around this idea that everything is genetic. Like, what are your feelings about that? And when you hear something like that, what comes up for you?
Well, I feel quite angry when I hear that. I know exactly the doctor you're talking about from Harvard, and we won't mince words again. A lot of what is being pushed here is quite demonic, in that you're taking the one thing which is in people's control, which is their lifestyle, and you're disempowering them completely. And something very strange has happened over the last 15 to 20 years. 20 years ago, even when I was first contemplating moving to the US, the world was a very different place. I believe that doctors were given more common sense advice, patients were held accountable. Where this quite started, why this started, whether it coincides with social media culture, who knows? But we've gone to a complete state of what I call clown world, where the wrong messages are being put forward by authorities, and everybody is jumping on board with these bad paradigms that ultimately are going to backfire. I mean, where on earth this started that obesity is genetic? For our top institutions to be pushing that, these people really have blood on their hands, because you're taking a very, very serious problem, which wasn't there to the same degree 20 to 30 years ago. You're taking a health catastrophe now that we have on our hands. I mean, me and you both live in parts of the country with supposedly lower obesity rates, and we look around us and it's awful. I wonder what the bad places are like.
Right.
And the most worrying thing is now what's happening with children becoming so sick. I've said before on my channel that this is unprecedented, and I would like everybody listening to take this in, because this has never happened before in the whole of history. We've faced other problems, including plagues, we've faced starvation, but we've never ever faced in humanity's history a situation where an entire population or multiple populations across the Western world are poisoning themselves essentially with food on a mass scale, and they're getting very, very sick. Obesity is not genetic. Maybe it is in 1% of cases. If it was genetic, then if you look back at photos of the 1960s and 70s when hardly anyone was obese, someone will have to explain to me how this suddenly became a genetic issue after hundreds of thousands of years of humans living on the planet. This is a lifestyle issue. We have to have the right leadership. We have to make people accountable for their decisions, and we have to empower people, and we have to tell people how sick they are becoming because of their lifestyles. We need a radical change. And I will say this because I know this was a long answer. There is a school of thought that doctors don't have any power over what people are eating and they can't change things. What utter nonsense. Doctors made people stop smoking with a big public health campaign. I mean, back in the 60s and 70s, when obesity actually ironically wasn't a problem, doctors used to smoke on ward rounds. We used to give patients cigarettes in clinics, and we had a complete turnaround from 70% of the population smoking to under 10%. During the last 5 years, the medical establishment locked people up in their homes and made them fearful to step outside over a virus which was very unlikely to be anything more than a cold in most people. I know some people were badly affected, but most were not. So if doctors had the power to do that, I don't accept the argument that doctors could not move the needle on this. And I would go even more extreme and say if doctors were on the ball, we wouldn't have even had this problem happen to this degree in the first place. It's because the medical profession is completely and utterly lost that these problems have spiraled out of control.
Whew, yes. I mean, I couldn't have said it better myself. And I feel a lot of alignment, just given my own personal experience, through COVID. And it sounds, and I want to hear, also about your story. How did there's one video that you have where you share that, Marcus Aurelius, like dropping in with Marcus Aurelius, meditations was what really got you through these kind of dark days during COVID. Can you share a little bit what you were going through and how you moved through that, with the support, obviously, this wisdom, but what was that like for you, and how did you it looks like, like you've transmuted that, right? And you've transmuted that frustration into education and sharing and empowerment. And so that's kind of one question. And also just, piggybacking about off of what you were saying about doctors feeling so powerless. I mean, I would also love to hear about, like, where does that sense of powerlessness come from? Because I agree. I mean, that like doctors are so, revered in the community, or have been, and seen as resources and powerful, makers of change. And like you just gave this great example about cigarette smoking and that whole, campaign. So those kind of just those two questions. Feel free to jump in however, however it feels.
Yeah, of course. Well, I think what you alluded to with doctors being respected, yes, I believe doctors are, but less and less. I saw a statistic now that less than 30% of people trust their doctor. I think this is fast eroding. I mean, you look at statistics now on vaccination rates plummeting, and it's a big deal that authorities in the US are pushing so hard for things like the latest boosters, big campaigns, and under 10% of people are actually listening. You would think that our authorities would take a step back and say, hold on, why
What's
is
going on
nobody
here?
listening to what we're
Right.
saying? It's
Right.
because people are smart. I mean, there's a famous saying, you can fool people once, twice, but the third time, even the dumbest person isn't going to be fooled. They're going to catch on to what's going on. And doctors, so my thoughts, as you know from my videos, they oscillate back and forth because as a doctor myself, I know it's a tough job. I don't think most doctors set out to harm people. Of course they don't. They want to do good things. But at the same time, I think doctors have to accept collective responsibility for what has happened. They can't just claim the, oh, I'm working hard in a bad system, and that's why I don't speak up, or I'm in debt, that's why I don't speak up. I think doctors should shoulder a lot of the blame for what's going on with the profession and the complete and utter failure of healthcare systems across the Western world. Your original question was regarding my own thoughts and feelings over the last 3 years. So those were very dark times. I still have to pinch myself to think only 3 years ago, I was in a position where I was about to leave the country because of these unethical, terrible, unlawful mandates that were being introduced totally anti-science, and how colleagues who I thought were smart, who I thought look at evidence, don't. And we probably, I'm sure we're not that far apart in age. We probably grew up in a similar era of being in peace and thinking that the world was very organized, and the era of chaos like World War One, World War Two, Vietnam were over. I've always been somebody who's interested in history, and I always used to think to myself, Diana, how did the world plunge to such darkness? How do humans do such crazy things? But it was during COVID that I realized that human beings are not logical collectively, can be panicked and put into a state of fear very quickly. And when there's fear, anything can happen, including things that will harm people. So you probably know my story. I got COVID very early on. It was a very mild case, and then I was checking my own antibody levels, which were very high. I knew I didn't need the vaccine. I had immense reservations about the technology. And I started speaking up about that, which was when more people started listening to me on YouTube. And clearly the message resonated that something wasn't making sense. And I never imagined in 2021 that they were actually going to mandate this this jab, which was obviously not doing its job as intended, was not stopping transmission, was not exactly what was advertised. People were getting side effects. I personally know many people who got side effects and adverse events, but there was a complete censorship there. And very close to having to leave the country. Thankfully, common sense prevailed, and I found some friends and colleagues to help through that. But then when everything started to subside and the world started to get back to normal, people like myself are really left wondering, well, yes, that happened. We were in a terrible position, but should we forget? Should we stop talking about it? I don't think we should. And Stoicism, yes, was a big help to me. And there's a lot of confusion over what Stoicism is. It's not a religion, it's more a way of thinking. And Stoicism is an ancient Greco-Roman philosophy. One of the most famous Stoics was Marcus Aurelius. And to give you a very quick summary of what Stoicism is, it's basically a way of thinking of the world in terms of you will never be able to control humanity and the crazy things that humans are capable of. The only thing you can control is your own reaction to situations. That's the only thing which is in your control. And you can see behind me here the book Meditations, which is the most famous book by the most famous Stoic, Marcus Aurelius, the great Roman emperor. And all the way through the book, he's talking about his experience as the most powerful man in the world and all of the crazy things that were going on around him, and how he came to realize that even as the most powerful man in the world, he can't change the nature of humans. Humans will always be humans, and the same things will keep happening. History may not repeat itself, but it will rhyme. But the way to ultimately put up with that is not to feel dejected or feel sad or go crazy yourself. It's simply to accept that things are the way you are, do your best, say your message, count your blessings. There are a lot of blessings to living today. We can speak freely. If I spoke out against the vaccine or anything else, I didn't have somebody coming knocking at my door with a rifle, as would happen in many parts of the world. I was still allowed to speak. And at least I wasn't living in times when there was no medical care whatsoever. So yeah, have that perspective about you. Put your head down, do what you have to do your duty, but don't ever expect too much from the people around you. That's what I learned. And this is going to happen again. I know that's a scary and horrible thing to say, but something will probably happen. Knock on wood, if we live long enough, maybe in the next few decades, there'll be something else which will come up and humans will panic and bad decisions will be made. But you just have to hope that common sense prevails in the end and you can get through it.
Thank you for that. I really appreciate the Marcus Aurelius story and sharing how that helped you. And I agree 100% that this, one of the things that has stood out for me over the last few years is the complete lack of accountability and it's kind of like, oh, oops, okay, we locked people up, we closed schools for 3 years for kids. I was on the other end seeing like the mental health impact on children as a pediatric nurse. And to this day, like you said, the ramifications are still trickling, like we're still seeing the impact of what happened. And it just seems that these public health officials who've made all of these decisions have not been held accountable, and that's nationwide, right? And so I completely agree that, if we don't hold people accountable, it's going to happen again. And so what does it really take? I agree. I think so much of what you said, even with regard to the doctors and your own story, really mirrors a lot of mine. And so I think that that's one of the reasons I've been so drawn to you and your message and how powerful it is, because it takes a lot of courage to speak out against what the mainstream narrative is. And
Narrative is, yeah. always the way. So
you
you were
know?
in a position as well where you
Oh
almost had
yeah.
to leave your job. Yeah.
I was in the same position where I said, wait, like I've already had COVID. Wait a minute. Okay. And then these mandates came down. California was one of the strictest, along with like New York, where they fired a bunch of healthcare workers. And it got to the point where I was questioning, like, I guess I'm done being a nurse, is this it, kind of a thing. And luckily I was able to move through that and receive some support and come out. But yeah, I ended up having to leave the bedside and
Wow.
take some time for myself and really actually start. That was kind of where my journey around food began and starting to start. I moved to Hawaii. I was living on different regenerative eco villages and studying regenerative farming and really getting to the bottom of like unpacking the crisis around our food system and seeing, being in a place where 85% of the food is imported when you can grow anything. It's like, what's going on here? So, and then really drawing the pair, like connecting the dots, to our health outcomes and what's going on with this metabolic crisis that you speak of all the time. And I really just appreciate, your candor and I think too, I'm curious, what was in medical school because for me I recently watched and I think that you were watching it too because you had a little clip on your channel with John Campbell
Oh yeah.
and
Do
yeah,
you
where
know
you guys
farm?
right where you guys
Yeah.
went to go see Duno Farm, right?
Yeah.
And there's a clip from that Jay Naidu said, speaks of, right, the freedom fighter, South African freedom fighter.
Yeah.
And he talks about, this here I wrote it as a little note because I wanted to read it, but he says what you saw in the development of modern medicine was a capture in the first instance of the training facilities of medicine. And so once you control the container that produces the people that are implementing the medical system, then you are in control of the system. And so for me, I think about medical education. And what was your medical education like? How did that, like, did you feel that things were missing? Did it feel holistic in what you were learning? And yeah, I'm just curious about that.
Yeah, I actually think I had a really good medical education. I went to Cardiff Medical School, which is about 2 hours west of London. That was a different era. That was kind of before our modern day sort of politics changed, if I can put it that way. And all right, I'll just use the term wokeism. It was before all that had started. And our professors were fairly blunt about things. But
Right.
granted, the metabolic health catastrophe was nowhere near what it is now. I mean, in my whole medical school, I think there was maybe one overweight person. People were in better shape back then. Society
Mhm.
wasn't as overweight or obese. We definitely didn't see type 2 diabetes in children like is
Right.
exploding right now. And I would say that our professors were fairly blunt and open. That was before a lot of the political correctness, maybe that's a better word than wokeism. Political correctness was not what it is. And then in the sort of 2005 onwards, I think everything changed. By then, I'd already
Mhm.
come over to the United States. So I'm pretty sure that that would be mirrored in the US as well, just talking to people.
Mhm.
Something has really changed since then. Um, if you look at the things that we talked about in medical school, it was mostly common sense, and people were told to avoid fast food, to cook at home, and all of the good versus bad foods out there. I mean, maybe there were some myths that have been around for decades, like margarine is better than butter, that you have to be careful with saturated fat.
Right.
But
Right.
metabolic disease was not as big an issue back then in the late 90s, early 2000s as it is now. But I could have never imagined like some of the things that are being propagated now by the medical establishment and they are fully backing would have
Yeah.
been unthinkable, like the transition surgeries, all of that in minors, which the American Academy of Pediatrics supports against what other countries are doing. I couldn't even imagined that that would even be an issue.
Yeah, that's it's been interesting to see that you know to see that shift happen so quickly. I remember actually even that I was in charge one evening on the unit I was working in, and one of the nurses came up to me and said, I'm going to need you to talk to this mom. She said that she thinks I'm fat shaming her child. And I was like, what? And this was a patient that was post-op, congenital heart surgery, and was, and then we can go down rabbit holes talking about the food in the hospitals. That
Oh
was one
God,
of my
yeah,
things. It's like horrible. It just feeding people poison.
yeah.
And so I had to, talk to this mother and really ask her questions. And she was clearly obese herself, and the daughter was obese, but she was eating a burger and French fries. And the nurse was really saying, like, hey, it's going to be really important for you to eat, healthy proteins and vegetables, and really get up walking, because you're going to need your for the healing process, right? And
Sure.
and she automatically took that as fat shaming. And that,
Offensive.
especially here in the Bay Area, that whole like, you can't even say anything to patients now. Doctors are afraid to even talk to their patients about losing weight, and actually taking responsibility of what's going on, giving the power back to the patients to do
Oh,
something. And doctors are afraid, and they're just not doing it. And I'm kind of like, that's, to me, that's just a disservice, and
yeah.
so it has been this hyper, like you said, political correctness around issues that are straight up like, no, this is an indicator of heart disease and
Exactly.
diabetes, and this is really about your health. This is not about fat shaming. But those conversations, it's like, it's really difficult right now because of the polarization in our culture to even have conversations like that. Like, how do you navigate that with your colleagues and also with your patients?
Yeah, I mean, it's very tough. I mean, obviously, one tries to be as sensitive as possible. I often will make a statement like, would you like me to tell you the truth, or do you want me to sugarcoat things? And I've never had anybody ever say to me, sugarcoat things.
Sugarcoat
They
it.
say, tell me the truth. I mean, I
Right.
try to be very gentle as well, and I'll
Of
say,
course.
well, what do you think about your weight? Are you doing anything to lose weight? And I can tell a lot of times they've never had this conversation before, when it's literally going to kill them if they continue down this route. But the truth is, the cells in your body, which are under stress, which are inflamed, your pancreas, your liver, they don't give two hoots whether you're offended or not. They are going to dysfunction. Your mitochondria are going to dysfunction. You're going to get sick. This is a health issue, and I accept it should be dealt with sensitively. And when I'm face to face to people, despite what some people might think looking at my social media posts, I'm always sensitive with people. I want them to be healthy. This is coming from a good place, but I'm not going to not tell you the truth. You have to hear it, and you are in charge. I'm not going to disempower you. You've got to make better decisions. And I think if patients had more of that, maybe throw in some health coaching or personal training on
Hmm.
top, they do want to do the right thing. And even if they don't want to do the right thing, I don't know anybody that wants their kids to be sick, right?
Yeah, exactly.
Yes, it goes against anyone's biology to want their kids to be sick. So
Right.
if you can frame it in that way, this is a big aspect, Diana, that scares me. When you've got 50% of adolescents now overweight or obese, it's a ticking time bomb. If we think statistics are bad now, wait for 10 to 15 years when these kids start getting type 2 diabetes, other inflammatory diseases, premature heart disease. We really are, again, coming back to what I started with. This is unprecedented what's happened. And you can pretty much draw a straight line to the shift we've had in our culture over the last 20 years with soaring overweight, obesity rates. I mean, America hasn't been known for a long time for being a thin country, but it certainly was nothing like what it was now 15 years ago. There's been a big, big change.
Yes, and that also brings me to, to bring up this topic around, which was one of the biggest issues I had during COVID, was why aren't we talking about what is causing people to get sick and actually die of COVID, which was these like underlying inflammation and metabolic disorders. So it was like all of the energy was placed into this one pathway. Everybody gets the vaccine no matter what. But why wasn't there that same amount of energy and resources put towards supporting people in, like you said, in the things that are in their control and their power, creating systemic change to support people with with real foods and connection to nature, coaching, these things that actually would support them to live longer and have better health outcomes overall.
Exactly. Yep, yep. It made no sense. It was almost like there was a deliberate plot to make people unhealthier. I mean, the worst thing you can do for a viral infection is lock people indoors, make them depressed, throw ultra processed food at them, keep them in the dark, no sunlight, no exercise. If you want people to get sick, that is exactly what you would do. And I saw very early on, I mean, over the course of the pandemic, I treated thousands of patients with the disease who were hospitalized in different states. I even worked in New York for a bit to help out at one of their hospitals, and ironically ended up being let go from that very hospital because I wouldn't receive the vaccine, even though I treated so many patients with COVID. So that just shows
Wow.
how things descended to ridiculous levels. But yeah, I saw from the very beginning that after the elderly, it was the obese that were affected. In fact, I don't think I had a single patient under the age of 60 hospitalized with COVID who wasn't obese. The only young patients in their 20s, all obese. And
Yeah.
that is because obesity is a state of inflammation and, in a way, accelerated aging. All of your cellular processes are misfiring. It's a pathological state. And if I was in charge, that would have been the message to be shouted from the rooftops. Hey, we have this virus spreading, and the best thing you can do for yourself is not take a shot. Certainly, that's up to you whether you want that. But the best thing you can do is really work hard to eat real food and stay in shape. That is your best protection. And the funny thing is that we always knew this. If you look at what Dr. Anthony Fauci, I actually call him Mr. Fauci, not Dr. Fauci, but if you look at what Mr. Fauci was saying 10 years ago, I think he did an interview, and the interviewer asked him, "What's the best thing I can do to prevent getting a bad flu?" And he said, "Should I do this? Should I do that?" And he stopped him mid-sentence and said, "No, no, no. Best thing you can do is eat healthy, stay in shape." So this is what really baffles me. Even Mr. Fauci knew this 10 years ago.
Yeah.
And what happened? How did the world collectively lose its mind, including people like him, who I believe are utterly corrupted? A complete deficit of logic and really focusing on the issues that really matter. Where did this dependence on pharmaceuticals come from? As if that's the only thing that could save people.
Yeah, I know it gets really dark as well once we go
Yes.
back and look at the history of the pharmaceuticals and the Rockefellers and whatnot, which of course I started diving deep into over my journey and recognizing oh, wait a minute here, like this is all it's really hard again, like it's hard to not I don't blame people for losing trust. I've personally lost a lot of faith in the medical system and in medical colleagues, similarly to yourself, who I trusted before all of a sudden jumped on this bandwagon. And I'm like, that is not critical thinking. And everybody should have the right to choose what is right for their situation. And there was just no option. There was only one option offered to everyone. It's so interesting you were talking about New York and getting let go. I remember recently reading this article on the New York Times, but I can't find it, how the New York State judge reinstates fired sanitation workers who did not comply with vaccination mandate. And it's interesting because they're still waiting. Actually, those workers are still waiting for the ruling, apparently.
Wow.
It's happening slowly. I think I just feel that yeah, it's hard to not look back at what happened and think, like you said, that there's some deep corruption here going on, and that then you look at medical education and how all the money Pfizer's giving to Stanford Medical Center, medical school, and how does that not impact the education and what the perspective that is being
Yeah.
offered in those programs. And so I also just wonder, like what is going on with doctors and again, like you say in your show, and I say this all the time, I have a lot of friends, colleagues, friends, good friends who are doctors and they're great people. And a lot of them are similarly to you, have been asking these questions and speaking out. But there is this underlying fear. Like
Yeah.
even, because a lot of doctors did lose their jobs, like similarly to you. A lot of doctors were canceled. I have a friend who is a physician here in California. She sued Gavin Newsom for his,
Wow, good for her.
yeah, it was her and a few other physicians. He had implemented some legislation that physicians were not allowed to uh, offer their perspective on the vaccine or any sort of COVID origin story, anything that, like, basically they could get reported by their patients or anyone and potentially lose their license. So
Wow.
he actually repealed that law because of that, but it really took a lot of energy and money and time. Like, it's a full-time job to pursue
Yeah.
things like this, right? So, oh my gosh, just there's so much with
Oh,
that.
it's a terrible situation. And
Yeah,
again, doctors need to speak out more. I understand the sources of fear. Doctors graduate hundreds of thousands in debt. They're then completely under the thumb, the boot of the physician societies who are
right.
heavily corrupted
Oh my
with
gosh.
conflicts of interest, the licensing authorities. I mean, the corruption is so systemic, it's at every level. But doctors have done this to themselves. They've surrendered their own profession. I was very disappointed that no physician society spoke out against mandates. I was actually proud of the UK in this regard because the Royal Societies over there of
Hmm.
physicians, while they were promoting the vaccines, they did actually say openly that you can't mandate it. It's unethical. They use that term,
Right.
unethical. But in the
Wow.
US, there was no such sentiment at all. Every single physician society was in lockstep. And yeah, it really makes you question the motives because let's be honest here. I mean, for all that there is good about the United States, there are many questionable things, and I would question the entire medical establishment and the way healthcare is set up. Here is a system that doesn't even provide universal coverage. It
Right.
bankrupts thousands of people every year over healthcare costs. You really struggle when you go through the system, even with insurance. I know people who've got insurance and they really struggle with outrageous bills. They can't go to certain doctors, etc. So you're telling me that a system like that, out of the blue in 2021, suddenly decides that they care so much about people that they want them to get this medicine. Give me a break. It's
Right.
all driven by finance. I've been on the inside. I know how it works. The physician societies and medical journals are all funded by big pharma, and I don't trust them. And I would seriously advise any member of the general public to feel the same way, to really do your own research because the recommendations you're getting are heavily corrupted, wanting to suck you into what I call the medical industrial complex.
Yeah, that's one of the reasons why I do highly recommend, films like this First Do No Farm, because it really uncovers that the revolving door of pharmaceutical or government agencies are these regulatory bodies that then go in
Exactly.
to sit on the boards at these at these pharmaceutical companies, and then how they in turn are also, like you just alluded to, running the medical journals that you know and then they said, because I agree. I think that all physicians know that pharma is motivated by profit, but there's no secret. No one's really trying to like stick up for that. But what they do listen to is all these medical journals, right? And they do follow all these journals. And then when you look at like what's being the research, who's paying for the
Yeah,
research, so it
exactly.
really, you
Yeah.
just have to ask these questions.
Yep, you do. You do. It's very sad indeed, but you can quite easily, if you look into it, draw a money trail from the
Right,
recommendation you're seeing to where it's coming from. And I find it amusing, and I do this with even mainstream media articles. They're also funded
right.
by big pharma. And I'll read an article and I'll think, oh, that's interesting. Let me look at the article, and then you'll see. where the conflicts of interest are, who funded the science and the researchers. And you think, oh yeah, there you go. And they also paid money to the mainstream media, to the cable news TV channel. It's all there for everybody to see. But it's a system which is rotten to its core. And the pharmaceutical industry is highly dangerous. In my opinion, it now has reached a point where it does more harm than good. Coming back to history again, throughout history, we've always had one dominant industry. For most of history, the war industry was highly dominant in most countries. They used to make a ton of money while sending millions of young men to be slaughtered on the battlefield in the meat grinder. Tragic. That happened throughout most of human history. And there was always someone benefiting from that. Then at the latter part of the last century, big oil became very big, and now it's big pharma. They pretty much own the US government. Two-thirds of congressmen from both political parties take money from the pharmaceutical industry. They own cable TV. They own medical publications. They own the physician societies. Thankfully, they don't own me. That is why I'm here speaking
Thankfully.
up.
Yes.
But this industry is highly dangerous. And ultimately, who suffers in the end? It's
Yeah.
always the masses who unfortunately will be in a position where they're getting information. They won't realize that it's tainted and corrupted. And they'll go along with the narrative. They will think that the answer to their problems, whether it be obesity, whether it be depression, whether it be some IBS or anything else, is to take a pill or an injection. And that's the current narrative. And eventually it will implode. The truth always comes out in the end. The question is, how badly is it going to implode? And how much damage will we even have any healthy people left in the end to pick up the pieces?
Yes, exactly. Which is why shows like yours and speaking out is so important, especially as healthcare providers, because so much of the public has kind of written off doctors and nurses as being, these compliant robots that have just gone along. And, a lot of people have seen that. And so it is important for people like us to use our voice and constantly reiterate the fact that there are good people who like us who are aware of what's happening and that we know it's our duty, it's our obligation. I say this to that especially physicians, because of the power that you all hold, that it is a duty to speak out and to advocate, because at the end of the day, what we've seen transpire over the last few years has not been for the benefit of the public. And so now it really is up to us to use our voice. Are you familiar with that his name is Matthias. He's like a psychologist from Belgium. He talks about this mass formation psychosis.
Oh, right. Yeah.
I was recently listening to an interview with him, and he was, talking about the things that kind of lead up to it, because he was observing COVID and how everything happened. And essentially it's what you were talking about with isolation and fear. So, you scare people, you isolate them, and then you have them connect over the things that make them anxious. And then you have this ideal that people will get behind. And
It's a
so there's,
perfect storm. Yep, yep. And
right,
then bad actors come in and make money. Yeah, exactly. And
exactly,
that was something that was said in the 1930s, actually, in
right.
Germany by the Ministry of Propaganda, who openly said, scare people, give them a common enemy, and you can make them do whatever you want.
Exactly, exactly. And then, he talks about this happening in stages. And he said that the last stage of this is where you get this group think, these people who want to eliminate everyone who does not agree with them. And again, going back to Germany, all of this history has shown us what happens. And so he said that that's why it is so important for us to speak up, because by us speaking up, we create an irritation in that story and that narrative, which then prevents them from moving on to that last step. So that was really fascinating. And
Oh, that's very interesting. And
yeah,
thankfully we live in times now where people can connect more
exactly.
easily and form a movement, which I feel is happening right now. I mean, you look even politically, if the election goes a certain way next week, the prospect of having Robert Kennedy Jr. in the health department it's an astonishing thought, and you may well see big changes because he's very much in line with our way of thinking and not
Right.
believing in the pharmaceutical narrative. So I really hope that the medical establishment gets its just desserts if he ends up leading undoubtedly they'll fight back, but he has the power then to defund organizations if he wanted to with his cabinet.
Right. And I'm curious too, because like we've been really kind of deep in the shadows speaking on all of this corruption and where we've been. But what is your vision? Like what is your vision for healthcare if everything were to go the way that you dream? What
Good
do you see?
question.
Yeah, what does that dream look like locally for you and your community? And then kind of how does that ripple out into the greater collective?
Yeah, so what it would look like is basically a return to the foundational principles of Hippocrates, the father of medicine. So if you look at the quotations from Hippocrates, he was very much focused on lifestyle, particularly diet, being the cornerstone of anybody's health, which makes sense because think about it, every cell in your body, every thought that you have is powered by what you eat. So that has to be the first thing anyone thinks of. So my ideal system would be one where a patient can go to their doctor, spend a lot of time with that doctor, and that doctor is really trained to think about root causes. Right now, we're in a situation where doctors in many specialties are basically writing a prescription as the patient is walking through the door. Give them a pill, leave my office, that's it. I would far rather that deep discussions were held about a patient's holistic health and well-being. Focus on these things. If people want to take the advice, great. If they don't, then there should be much more resistance to prescribing medication. I mean, I'm not anti all medicines. Obviously, I work in a hospital. There are some great medicines, like if somebody comes in with sepsis, as you know, we have antibiotics that can reverse the situation in hours. They're great medications for other conditions, heart attacks, other acute systemic conditions, but it's a last resort. It's only as a last resort. What needs to happen with this focus on health and well-being is for this to start from the very beginning, from schools educating children on what is good, what is not good, cooking classes, understanding all the things that will make them sick, thinking about the link between physical disease and mental health, having more mental health support in general, get into the right habits, put down the phone, get outdoors, play more, have times during the day where you don't even look at your phone. All of these policies need to sort of come together in a holistic way. And ultimately, I think that if we returned to that sort of paradigm where doctors didn't immediately think themselves that the answer to everything is a pharmaceutical product, then we could change the world. But there has to be a multifaceted approach. I mean, at a government level, for instance, right now, we give subsidies for all the wrong types of food. The poorest people in our society are flooded with ultra processed garbage, with sodas, consuming ridiculous amounts of sugar. This is going to need to be a multifaceted approach. Doctors alone can't do this, but doctors speaking up collectively will really move the needle because I really believe people listen to doctors.
Yeah.
They do listen. Never, I don't think any doctor should underestimate how much power their words have. You probably feel the same way as a nurse. Doctors don't realize that if they just said to every patient, listen, give some serious thought about cutting the amount of bread you eat in half. I just thought about that example off the top of my head. Or why don't you just park a little bit further away from the grocery store, walk a little bit more, get your steps in? If
Yeah.
patients were hearing these messages consistently from their doctor, you would see change. You would. People listen to things and they take things in slowly. And we saw that with smoking. All right, people still smoke, but it's much less than it used to be because doctors spoke up about it and really enforced the issue and said, you need to stop smoking. I mean, thank goodness the smoking disaster didn't happen now because no doubt with our current level of clownery, the answer would be from doctors, oh, it's okay, you can keep smoking. We'll just give you an injection every week. Or
Right.
let's do this surgery and put a filter in your lung.
Yeah,
That's
exactly.
that's what would
Put
be.
a
Thank
filter in your life.
goodness back then doctors had some common sense.
Wow. Wow, yes. Oh, I love that. And I think it's really beautiful to think, to imagine with you, that doctors are speaking out and they're organizing and they're coming together in this way around advocating for holistic health and making it accessible to patients, right? It's like it is very easy to just park further away. When we're talking
Of
about
course.
greater systemic issues like food deserts, that definitely requires a lot of coalition building and whatnot, but I still think it's extremely impossible to bring a farmer's market to your community. That's what I'm trying to do here in
Yeah,
my
just do something
neighborhood.
fantastic.
Just do
Yeah, just
something,
something.
right. And it really is that simple sometimes, because I feel that even we're talking about this documentary and we're talking about all of these, the corruption can feel, a lot of people don't even want to go there because they feel so disempowered. And I
Yeah.
always just try to remind folks, and it's one of the things I really respect about you as well, is your message of empowerment, that we do have power to change. And like you said,
Of
with
course.
organization, we can make things happen because
Yep.
we have to. Like what we already kind of know the trajectory of where we're going right now if we stay on this path, right?
Yep.
And
Exactly. And we need
yeah,
it to be in the areas that need it most. I mean, we're in areas which are probably quite healthy already. Those farmers markets need to go to Mississippi or that small town in Texas where 90% of people are obese. But culturally, things need to change as well. I mean, look at cable TV. Every single ad is a farmer ad or a fast
yeah.
food
Oh my
ad.
gosh.
There just has to be a huge cultural shift. And there's two ways this is going to end, Diana. Either, well, maybe three ways. Either we're going to reach a level where we fall off the cliff and we have no other option, or we reverse the situation because pendulum swings back and people realize they're going to be healthier, or there's some external event that happens that forces things upon us. But yeah,
Right.
this isn't going to end well on its current trajectory, and it's just getting worse and worse every year, sadly.
And it's really interesting how in these bigger cities that tend to have a lot more resources, i.e. like government money, or
Yeah.
that is allocated for things like mental health or healthy foods or whatnot. Those are in these larger cities that people are much more disconnected. And so I also wonder too, it's like getting to know your neighbor, like who lives around you, how does that impact your mental health? And it's really
Yeah.
kind of just that simple. What do you guys care about? And taking the politics, to me, I still don't understand how health has become like a political issue, right, over the last 4 years.
Yeah.
It's blown my mind. And how do we start having conversations, like you said, around, we want our kids to be healthy, we want them to go to be safe at schools, and we want to be healthy. It's building a community around those like issues that bring us together, that
Of
I feel
course.
is really important right now.
Yep, it is. It is. Yeah, we're a long way from it, but fingers crossed there things will change. The only way they will change is for people like us to keep speaking out about it.
Right. And also just modeling it too. I feel that we have to, one of the things, I see a lot with physicians, which I feel is very hypocritical, is like a lot of preaching about what people should do, but then they're not doing it and they're
Oh, of
depressed and
course.
and so there's a lot of that hypocrisy in the medical, same with nurses as well, right? It's like, how well are we taking care of ourselves? And that's an issue that
Yeah.
I really care about, is like, we have to actually model it if we want people to, I mean, how many times have we seen really obese physicians coming in to talk about metabolic health, and what
Oh,
what
of
kind of
course.
patient is going to take you seriously when you come in? Like,
It is, yeah. I mean, I've stopped going to a lot of physician conferences now, but my last one was last year, and I'd say over half the physicians were overweight or obese. I mean, what kind of example does that set? I mean, it's like having a financial advisor who's broke, who's bankrupt. Well, how can you possibly take any talk about well-being seriously? They can't even take care of themselves.
exactly. So I really feel that that's also a huge opportunity for us
Oh
to
yeah.
really advocate for the health of our colleagues, because they're, so then, because then, and then if we think about it, like if we look at the suicide rates of physicians and just even the general health of physicians, how can we be surprised that they don't have the courage to speak out, and do the things that we're doing. Like you're traveling and,
Yeah.
it's sharing your beautiful travels and like the healthy foods and really offering so much. But I just don't see how anyone who isn't healthy can do that. So
Yeah.
what does that look like too, right? I feel like we could talk more about that. But so, well, wow, I can't believe our time is already coming to a close. I'm
Wow, gone fast.
It really went fast, and I feel like there's still so many questions I have for you. So I would love to have you back on the show whenever you feel that you would like to be here.
Sure, it would be a pleasure. Lots to talk about, lots to talk about, and hopefully we may have some change over the upcoming weeks. Who
Yeah,
knows? Yeah,
yeah, maybe there'll be
things
some
can change very fast. Remember, if this disaster happened in under 20 years, who knows where things will be? But something tells me that it's going to take longer. We're in quite a pit right now, sadly, with the level of awareness, with the messages that are coming from the top, the state of medicine, the state of doctors, but things can always change. Who knows? We have to stay optimistic.
Yes, thank you for that message. And then is there anything else you like feel that called to share with the audience or invite people into? I mean, your channel, I'm going to share all of your the way to connect with you, your links in the show notes, but any last calls to action for the audience?
Yeah, I would urge anybody listening to remember that most of your health at any stage of life is not your genetics, it's your lifestyle. And life is short. We have this one body, it's our temple. We owe it to ourselves to really be the best version of ourselves. And often it's the small changes that really matter. You can start off small. I've mentioned a few things like walk a little bit more if that's all you can do, cut a little bit of the bread out, eat a lot more of the good food, go natural, avoid the ultra processed foods, cut back on sugar. I mean, there's a long list of things, but any little thing you can do every single day will add up to a healthier version of you after a few months. Please don't think that your future, your salvation rests in a pharmaceutical product. It does not. There are lots of natural things you can do without the side effects that will result in you being a lot better physically and mentally. We have a lot of illness out there, which is self-inflicted, and it's not your fault. You're a victim in many ways of a toxic culture, but you can pull yourself out of that. Many, many people have. And I'd urge you to just keep thinking about that every single day. Be the best version of yourself, because if you're the best version of yourself, you're also a better version of yourself for your family, for the people you love, for your work even. And once more, life is short, so don't waste any time getting right onto this.
Beautifully said. Thank you, Dr. Dan, for being here with us. And we look forward to having you back on the show.
Thank you, Diana.